most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Boy, you're really yelling today, aren't you?
Well, we've got
I like the
compression.
enthusiasm.
We've got compression.
All right, 3 simple exercises to stop the shoulder and arm pain coming from your neck.
Right.
So that's the distinction. A lot of us, you have pain going down the arm, from the shoulder down into maybe even to the hand.
Sure.
And you're thinking it might be from the shoulder. It might be, but it also might be from your neck. And so we're going to show you how to tell.
Right.
And by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, join us on our social media channels because look at this baby. We're giving away a Sleep Ovation mattress. It's got 700. Now, this is a small one. This is a
demo.
A demo. But you just got to go to like our Facebook page or to Bob and Brad giveaways. And you can sign up and take a chance at getting one.
Right.
For free. We also have a sale on them too.
Oh, yeah, absolutely.
So why don't you start talking, Brad? I'll get rid of this.
Yeah, I'll talk. I won't sing, but I'll talk. Okay, so shoulder pain, arm pain, that is when someone comes into the clinic with that, I'm usually pretty optimistic, and I was talking to Bob about this. I think a lot of therapists are because oftentimes it's a problem that you can fix and the person can actually go home, do some changes in their life, some exercises, some postural change, and have very good success in completing it. So we're going to show you, first of all, if you do have pain there, how do you determine, is it the shoulder causing the problem or is it from the neck? And the tests are not real complicated.
Yeah, we'll show you a couple that, I mean, it's sometimes it takes, you're not going to be able to tell yourself you're going to need a therapist.
Right.
I mean, because sometimes it's a little dicey.
Right.
It's really difficult to tell, but other times it's quite clear.
Right. So before we get to that part, we're going to use Sam for a little anatomy lesson, pretty short one. And we're going to look at Sam here. This red, we got a little tubing here that represents the nerve coming out of the low neck. Okay, and actually, it's more than one nerve. There's a bundle of them called the brachial plexus, but this is the pathway. It goes through near the first rib, under the clavicle or the collarbone, and then it goes down through the axillary region or the armpit, and then down into the arm, around the elbow, all the way to the hand. So if you pinch the nerve or irritate or do something to the nerve up by the neck, you're going to have pain that can radiate down the arm, sometimes into the back of the shoulder blade area, down the arm, and possibly to the hand and fingers.
Also, even the muscles in this area could be pressing on the nerves.
Right, right.
So, or the rib.
Or the rib.
Yeah.
So as a therapist or a doctor, they typically will screen the neck first if we have pain down this arm so that we're not treating the arm and then find out the problem is up in the neck.
Yeah, because you can treat the arm all day long in that instance and it's not going to get better.
There you go. So let's go through a few of the tests, Bob.
Couple simple tests.
First thing I'll do, and this is a pretty quick screen, I'll have the person sit down in their chair with good posture, and I'll have them do this. Can you sit up tall with good posture? And if they can do that, then I'll ask them to lean back in their chair and then just slowly look up towards the ceiling. Now, if it is related to the neck, they'll get about usually around this far. And if they say, ow, my shoulder or my arm pain gets worse, and that's all they're doing is moving their neck back, it's a very strong indicator that the problem is from the low neck and not the shoulder.
Right. If you're having a problem with your shoulder, rotator cuff, or impingement, and you don't move it at all, there's no reason it should. I mean, if it's hurting already and it stays hurting the same, then it's not the neck. But if it's hurting and then it hurts more when you do this, or it's not hurting and then it hurts when you do this, in any one of those instances.
Right. So that's a pretty strong indicator. And I found that that's not uncommon. I'd say it's common to do that. And then there's some other screens. I'll do a compression test. And this is, the person sits up nice and tall, good posture, and I'll gently go on top of the head and push down so it compresses the cervical vertebrae, and it doesn't take much pressure, and if that creates pain, particularly down the arm, it's a good indicator also that the problem is from the neck, not from the arm.
Bob, you're going to mention Sperling's test.
Sperling's,
another test you can do is actually you bring your neck back and off to the side a little bit and then push down. You could even push down yourself, Brad.
Sure.
I wouldn't push down with the arm that you're having trouble with, but you could push down a little bit like this, and then go to the other side and back a little bit and push down. And you're really compressing on the foramen then.
Sure.
The holes where the nerves are coming out,
Right.
you're closing them up a little bit and you're pushing down on them. So quite often that does, if it is nerve pain, that does elicit it. It does
Right.
bring it on.
Those tests are what we use, and I've used, and typically it's very clear
We'll
that
look
the
at
neck,
some other things too, but it gives you a good indication. More than likely
Right.
that that's what's going on, or at least that's a part of it then.
So someone's having problems. You feel confident or relatively confident the problem is from the neck and not the shoulder or the arm. One of the first things I'll do is have the person sit up tall and just start to do some chin tucks, and do them repeatedly. Just go back as far as you can, and oftentimes they'll say, "Oh, that hurts." And if that hurts and the pain feels like it's more from the low neck, and it's getting better in the arm or the shoulder as you do them repeatedly up to 10 times, then you're going to continue to do them. And that's called centralizing if the pain moves up towards the shoulder and towards the neck.
If somebody is really sensitive to start off with and really bad, they might try those laying down
Right.
first. So,
Good point,
and
Bob.
I'd even put a rolled towel
Sure.
here like this and put it underneath the back of the head like this, and then just do some chin tucks like this. And almost anybody can do these without increased arm pain. Sometimes I'll even put a pillow underneath their arm, Brad,
Sure.
to kind of
Yep.
put it in the right position so it's a comfortable position. But if you're really, quite sensitive, you might start off with this one. And what we're going to have you do is we're going to have you do these quite often, 5 to 8 times a day.
As long as they make
are
it feel
working,
better.
right?
It has to get rid of the arm pain or make the arm pain come up. And by the time you're done with the 10th one, it's like, oh, I feel better. If that's the response, then you do them that
I've seen people complain about that many times, but it's like that's what it takes to get better. You've been doing bad things with your neck, posture-wise, probably for years and years. To correct it, it's not going to be some magic pill or magic exercise. You got to do repetitions.
Usually 1 or 2 days after doing these, you don't have to do them that many times.
Right.
For
It's not
weeks
for
on
life.
end.
What's nice about the chin tucks, you can do them anywhere.
Right.
Same with this exercise. You
Yeah.
can virtually do this anywhere.
Sometimes the
this one
chin,
first, or do you want-
sure. Sometimes the chin tucks will work or only partially work. Then I'll take a towel because we want to get to this point, this range of motion, normal cervical or neck range of motion without pain. And if you can do that, chances are all the pain
I'd
will
probably
go.
move your glasses, Brad.
Oh, sure, will resolve or go away. Thank you, Bob.
Yeah, you're welcome.
Yeah, no, and I know he cares about me. You can take a towel roll and then put it low on the neck. And then usually if someone has problems doing it this way and it creates the pain, if you support the low neck and you gently go back, they'll say, oh, wow. If you can do this and it's like, oh, it feels better now, I can go back farther. That's a real good positive
Was
sign.
I not paying attention, Brad, or did you talk about that? What we're trying to do next from the chin tucks is now neck extension. Well, anyway, so he's trying to work on these, and what he's saying is quite often when you just try these without the towel,
Right.
it hurts. It's like it's just real uncomfortable. Might even make
Yep.
the pain worse. So then you go to the towel
Yeah.
first.
I could
and
have
use
swore
that.
I said something
Maybe
like
you
that.
did. I drifted off.
So then you do this and you just bump into it. You don't force it and think you're going to get it all at once, but you gently go into it. And each time, if it feels a little bit better, no more than 10 at a time. By the 10th one, if it feels better overall, it's like, oh, that did help. Then you're going to do it more, and you're going to do it every 1 to 2 hours.
Right. And the thing is, eventually you want to try to go further and further.
Right.
I mean, the magic tends to happen is when you get all the way back, and that's
Right.
when things start to
Right.
really improve. So another way to do this is actually you can take, I would rather prefer a little bit of a longer towel than this one.
Sure.
But you're going to take the selvage. Is that what it's
The
called?
edge of the towel. We always
Yeah.
get corrected. Someone usually corrects us on the
It's selvage
comment.
or selvage.
This
So-
is our third option, by the
Yeah.
way.
So again, it would normally be a little longer, but it's going to come underneath the ears like this. And the same thing, I'm going to pull and I'm going to work backward like this. The fingers and the tip of the towel, I guess you'd say, stay with my eyes.
Right.
So I'm moving my mic, so I don't know if it's working at all. now,
Yeah.
but
Yeah. Well,
but
they,
what's
they
nice
shouldn't
about-
be wearing a mic.
what's nice about the selvage is that you can move it up and down then. You know what I mean? You can
Right.
hit different levels of the neck.
Right.
So I'm hitting down right here, down lower, and I can work on going back like this. And if you have a painful arm, a lot of times I'll have them do it with one arm.
Sure.
Like
Right.
this.
Yep.
This is
Yep.
really not very good because it's such a short toe.
If you happen to have a stretch out strap, the strap for stretching with loops in it, they actually work really well.
They do work really well. I was surprised because they have kind of a little grip to them.
Yeah, and you don't have to grip because you can use those loops. And I'm going to go down one more, and they're every 6 inches. So you
Well,
can,
again, you could do it one arm, Brad.
oh, sure, look at that.
You're gonna be, yeah, one's going to be painful. So
There we go. And I could move it down. And you'll find the level, whichever. Sometimes I'll have the person move it just an inch down, and it makes a tremendous difference on
absolutely.
decreasing the pain while increasing the range of motion. So,
Now, if none of these work, there are other ways. I mean, other things a therapist would have you do. And
Right.
We do have a video like on how to find a McKenzie trained therapist. This is based on Robin McKenzie's technique, the
Right.
McKenzie technique.
yeah.
So you could find a McKenzie therapist in your area. So
Moving.
remember, Brad and I can fix just about anything.
Except for,
A broken heart.
but
We're working on
there
it.
you go.
You don't
Maybe
believe us,
one of
do you?
these things will work.
Yeah, maybe. Who knows? Thanks for watching.